Hello, and welcome to the Back on Track Achieving Healthy Weight Loss YouTube channel. I'm your host, Dr. Alicia Shelly. So Zepbound is here. You do not know how excited I was when I heard that the FDA had approved Zepbound. Now, if you're like, what is this lady talking about? Zepbound is basically the medication, aka Mounjaro, but it's actually FDA approved for obesity. So the one thing that I've been seeing is that I've been seeing a lot of great results with Mounjaro, especially for people who had diabetes or do not have diabetes. I really saw it really helped them with losing weight. However, Mounjaro cracked down. And so now only persons who have type 2 diabetes can be approved for Mounjaro. And so it really left a lot of people who had been on it for weight loss out in the cold, because now they had something that was helping them with their weight. They were feeling great. They had a better quality of life. They were losing weight. They felt better, most importantly. And now it kind of was like the rug was taken out from underneath them. And so for the last 6 or 7 months now, we've been trying to figure out how can we help these individuals. And so now that Zepbound is approved, and then let me not even forget this fact, even if I tried to send them to Wegovy, there was back orders on Wegovy. So it was hard to get that for patients. And then if you wanted to start somebody on Wegovy, we couldn't get there. So it's been very frustrating. Lots of calls, lots of messages in my office trying to find other alternatives. And so when I heard that Zepbound was approved, I was like, yes. I've been waiting for over a year for this medication to be approved. And so I'm so glad that it's here. And we're going to talk all about what Zepbound is, what are the side effects, how do you take it, and honestly, how much weight do you expect to lose? These are important questions. So first, let's talk about what is it. So Zepbound actually targets 2 gut hormones in our body. One is called GLP-1, the other one is called GIP. And how these hormones work is that it increases the level of the hormones in the body so that you have decreased food intake. I mean that you're not as hungry, you're not eating as much. It also allows you to feel more satisfied so that when you do eat, you're like, I'm not eating as much and I still feel satisfied. I don't need to eat anymore. But then also for those people who may have some insulin resistance, meaning that your insulin levels are high, it helps with reduction of that and it helps with improving those levels. Now, as far as how do you take it, my suggestion is that, it is recommended, this is on the label, that you start off at the lowest dose of 2.5 milligrams and you go up 2.5 milligram doses until you get to the high dose of 15. And you do that every month. So every month you go up by a dose. Now, I do have patients who tend to have a little bit of the side effects, and we'll talk about that in a little bit here. But if they're having more side effects at a certain level, then we'll go down a dose or we'll kind of stay at the same dose a little bit longer. Usually a month is good enough for your body to get used to it. But if your body's not getting used to it, do not push it. Stay where you are or go down. And if it's really, really bad, then you may need to stop altogether. So there have been reports about gastroparesis with Mounjaro, with Ozempic, and it's not many. Really, I think the last time I checked the FDA, it was like 265 reports of gastroparesis. But I do see a lot of people who suffer with nausea and vomiting with these particular medications, the GLP-1s. That is a known side effect. And so how we try to reduce that side effect is, number one, tapering up slowly if need be, which is why they have you go up every month of those, so you're not going up too fast. But then if you're still having these symptoms, then going down until your symptoms are improved, or maybe stopping the medication altogether. And I've had to do that for patients because their quality of life of having nausea, vomiting, and diarrhea all the time is not great. And so we need to be able to find another option for that. And so we do. So like I mentioned, as far as side effects, the most common ones, nausea, vomiting, diarrhea, constipation, stomach pain, indigestion. So some people have these sulfur bars, which is basically a sign of indigestion or heartburn. So you sometimes can use, definitely it's important to talk to your doctor about that. And there are actually over-the-counter medications that help with heartburn too, as well. The other thing that is contraindicated in this class is if you have a family history of medullary thyroid cancer, then you should not be on this medication. Or if you have a history of NEN2, then you should not be on this medication. Now, Now, it has not been shown in humans in this particular class to develop thyroid cancer, medullary thyroid cancer, but it was shown in rats. So therefore, that's why they recommend that anyone that's on this should not have a family history. And you should not try it if you do, because they don't know the side effects with, in that subset of people who have a family history. But they have not seen it in humans. It's just in rats. And the other thing I would say is if you have like acute pancreatitis, you should be very careful with this medications, just in general, the GLP-1s, because it can trigger pancreatitis in those who have that history. So you should kind of monitor that. Also, too, gallbladder disease. They noticed this in Wegovy, that there was an incidence of gallbladder disease. So just be mindful of that. Sometimes if you lose a lot of weight, you can develop gallstones. So, and then 1% of people in Manjaro can develop gallstones too. So just be mindful of that too. So those are kind of the side effects that you can see. The one trick that's been helpful for my patients is that if they're experiencing some nausea, they'll change the site that they give it. So instead of giving it to themselves in their abdomen, they'll give it to themselves in the top of their thighs, at the back of their arms, and it helps. The one thing I like about the Zepbound is just the pen. You don't see the needle. You basically clean the area off with alcohol, press down the pen, and then first of all, don't forget to unlock it, because there's a lock that unlocks. You just unlock it, and then there's a button that you press down, and you hold it until you hear the click, which is about less than 10 seconds. And so it's very easy to do, and then you just throw the pen away. You don't have to think about it. And it's I think I buried the lead. It's once a week. So you don't have to do it every day. You just remember the day that you do it, and then you do it that day. The other thing, if you're experiencing nausea, do the injection at night so that you have the most nausea during the night when you're sleeping and you can't. So that would be my suggestion for that, to how to reduce those symptoms. Now, what's the average weight loss? So the average weight loss for Zepbound, seen in the Sermont 1 trial that looked at just people with people with just obesity, was around 20%. So 20% at the 15 milligram dose. And I've seen people lose more. Of course, that's the average. People lose more, people lose less. But this medication has been very, very instrumental. I really see a change in patients when they come back to see me on this medication, really see the stride. And I think once, people don't have the side effects, this is something that they want to continue. So the last thing I would say, who was this medication indicated for? Well, it's indicated for people who have the diagnosis of overweight and obesity. And that's usually diagnosed as a BMI of greater than 27 with comorbid diseases like diabetes, high blood pressure. Then they would, or have a BMI of 30 and above without any medical conditions. So with these conditions, you would be a good candidate for Zepbound. Now, it is always important that you talk with your doctor about the different medication. Right now, as of today, this is November 12th. It's not quite available, but it will be available in U.S. pharmacies soon. And so definitely go to the website. I had checked last week and the savings coupon wasn't up, but they should be having a savings coupon for those who have commercial insurance, and then they have coverage for Zepbound. Then you can get the price down to $25. And also, let's say you have commercial insurance and you don't have coverage for Zepbound, then according to the website, you can go and check me out on this, because it may change by the time you watch this video. It's around $550 a month. So that is a nice benefit, because if you were to pay cash for this, it would be around, $1,300, $1,500 a month. So that is nice. They're able to bring down that price for people. The other thing I would say, if you have like TRICARE, Medicare, Medicaid, right now, at least with the Medicare, they don't cover weight loss medications. I know I have some patients who have diabetes, and we can get some of the medications like Ozempic and Mounjaro covered, but it just depends on insurance. So you definitely want to check with your insurance to see what they cover, because not all insurances cover weight loss medications. Also, too, if you have an employer that is giving you your insurance, ask them to add an obesity rider onto your insurance so that they can be able to cover weight loss medications and weight loss surgery. It just gives people another options, because we do know with obesity that by losing weight, we can improve over 200 medical conditions. So it's important that we have access to that. It's not just just, some people think it's a cosmetic. No, it's not. You are saving lives by treating someone's obesity and having a better quality of life. A lot of my patients say when they lose weight, like, I feel better. I have more energy. I can move more. Like, it really changes their quality of life. And so it's important that we treat obesity and allow the different tools that are needed, such as medication, bariatric surgery, and all the different tools that are available, lifestyle changes, they should be covered. And if you have Medicare, Medicaid, or state insurance, advocate, get together, have people write your congressperson to say, yes, you all need to cover these medications because this could help me with improving my quality of life. And sometimes if we can prevent somebody from developing a heart attack or stroke by reducing their weight, that will actually save money in the long term. So advocate, definitely advocate for yourself. Send letters, get groups of people, sign petitions, because we really need to have these medications covered. And I think with Wegovy, with having the back ordered issues in Manjaro, and hopefully won't be too much of a problem with Zepbound, by having these medications available really make change in somebody's life, we really need to have better access. So I thank you for listening today. And feel free to leave questions in the comments. I'm going to come back and answer them, or I'll just make a video for you. All right. See you next time.